Yesterday, the Department of Health and Human Services announced that it is making up to 442,000 doses of the Jynneos vaccine available for states and other jurisdictions to order as part of the national vaccine strategy to try to combat the current monkeypox outbreak. So joining us today, our 9 News health medical expert, Dr. Paul Coley. So let's talk about where we are with the monkeypox outbreak comparative to previous American outbreaks. We're a little familiar with the most recent one.
You know, we're in a whole different position than we were before. So 2003 was the last human outbreak here in the United States. We had 47 confirmed or suspected cases. Now we have nearly 12,000. So this is sort of a situation where the horse is out of the barn. We really have to figure out how to get it now back into the barn.
And when it comes just to the likelihood of like the 3 of us getting it, or even kids, right? We're going back to school now, there's play groups. Should parents be concerned about this being something that's going amongst our kids as well?
I am starting to get more concerned about community transmission. So some of us, like Tom, might be protected because we got the smallpox vaccine.
If you're old enough.
Right. If
say it.
This old guy is fine.
If you're old enough, you're probably protected.
It doesn't matter how young you look. If you're old enough, born before 1973, you have the smallpox vaccine. You're likely to have some cross protection. But for those of us that are born after 1973, we're a little bit more at risk. And now we're also seeing transmission in kids. So we have seen cases now occur in kids as well as heterosexual people. So it really can affect anyone. And I think it's important to know how it spreads and know how you can protect yourself and prevent it.
Will you know right away that you have monkeypox? Should you be testing, or will you have to wait until the lesions that we've seen on some people start to form?
You may not know right away. So you may just have a kind of a cold or a flu-like symptoms early on. The 2 giveaway signs are the lesions, as you pointed out. If you start to get those, of course, you have to get tested right away. But also if you get swollen lymph nodes, that's the other dead giveaway that this may be more than just a flu or even COVID.
Even if you have it, though, you say the vaccine has value.
That's exactly right. So if you've been exposed, you have about 4 days to get the vaccine. If it's been more than 4 days since you've been exposed, you have up to 2 weeks to get it to reduce the intensity of your symptoms.
But the accessibility of this vaccine, I mean, the rollout was so slow, and now we hear some people are only getting 1 vaccine and not 2. Like, how is the government working to get us this vaccine?
It's been a real problem, and that's how the horse got out of the barn. I think we didn't move fast enough on the vaccine. So of course they've manufactured more. They've also changed the way they're administering it. So now 1 vial can actually vaccinate 5 people at a full dose. So instead of giving it right under the skin, subcutaneous, they're giving it intradermal into the skin. So they need less of it to elicit the same sort of immune response.
If you have monkeypox, is there a treatment? How do you go about treating it?
So for monkeypox specifically, there's not a treatment, but there is a treatment for smallpox called TPOX, which was FDA approved, and it's been authorized for compassionate use for monkeypox. And this is another one of the challenges, the testing, the treatment, and the prevention of this, is we're just not getting enough people on TPOX, because getting it from the national stockpile, it's a challenge for physicians. I have a colleague who has a patient with monkeypox, and he's been trying for weeks to get his patient TPOX, and at this point the infection's almost resolved.
We've learned about these factors now of communicability with diseases as we've gone through COVID. Certain things were very highly communicable. What about monkeypox? Is it something that is extremely communicable, or less so than what we've been dealing with the COVID variants?
You know, less so than COVID, because less contagious from a person-to-person standpoint, but it can survive on things like bed sheets and towels and clothes, even if you go to a department store and try them on. So there are different ways that we can acquire this.
Well, what do you tell travelers then? If you are traveling, how would you warn them or prepare them?
I would say make sure those sheets are washed in hot water before you get into them. So if you're staying at an Airbnb and you're not sure, maybe just throw the laundry in before you use it. Same thing for the towels. And if there's any doubt in your mind, or you're a high-risk person, in terms of your underlying health conditions, then talk to your doctor about getting vaccinated as you travel.
Good advice.
Play defense. Be smart. Dr. Paul Coley, it's always good to see you. Thanks for your help today.